Hey guys, welcome to part one of the Strength HQ Mobility Series with myself, Robbie Smith, and Superstar Physio Andrew Locke.
Great to be here today, Dr. Robbie, and we're looking forward to educating you in regard to the most important mobility movements for setting yourself up for huge lifts and safe lifts. Alright, so the focus on what we're going to do today will be some mobility work. Now, mobility isn't stretching. Stretching is something we don't tend to encourage before any workouts because there's a tendency to put ourselves in a bit of danger through upsetting our Golgi tendon and spindles, and when we're loading up big we want them to be at their peak. So with mobility work we're looking at what joints do. We're looking at making sure the joints have their full range of available motion and that we're safely able to perform whatever movements we're going to do with the best of strength that we can apply. Now with mobility, we're going to work with the 5 main areas that I look at. We're going to go with cervical spine, thoracic spine, lumbar spine, shoulder and hip. Does that work for you, Robbie?
Certainly does.
Alright, well we shall go into starting with some cervical spine work.
Go.
We're going to begin today with looking at the neck. So we're going to look at cervical spine mobility. One of the things we recognise is our postures and positions through a normal day, they're going to have an influence upon what happens when we train. So I want to make a person's body as resilient as possible to training. I want to make sure the person's ready to train. So I'm going to be starting with neck movements. Most people sit all day, they'll be sitting in chairs, they'll be sitting for driving, they'll be sitting for eating. As a result, their head postures tend to be forward too much. So with mobility work for the neck, I'm looking at neck extension and rotations. So they're the first 2 movements I'll look at as I'll demonstrate on these models. So here we have the cervical spine, or the neck bones. Basically we've got our 7 cervical vertebrae. Now, in the neck, as opposed to the thoracic spine, as opposed to the lumbar spine, the joints here have a relatively horizontal inclination. Now, what this allows the neck to do, it allows it to rotate. So the neck has rotation as one of its major aspects. Also, it allows good extension as the joints move over each other. So for mobility work, we're going to be looking at extension of the cervical vertebrae and rotation of the cervical vertebrae. Now, lateral flexion into this movement, or into this movement, is a combined movement. It has both rotation and downward motion. So we only need to mobilise into rotation to achieve some lateral flexion. So we'll now go to Robbie. So here we are. There's Robbie sitting in front of me now. That's how his neck looks. Most people spend their day with their head forwardly placed, usually on a computer, working, slumping. Now, a normal human skull, brain, head, weighs approximately 8 kilograms, right? So, if Robbie's 7th vertebrae is here, I like to make sure in good posture Robbie's head should be here. Now, in a normal daily posture, most people's heads are out here. Now, this is 8 kilograms now placed forward at the lower vertebrae. Now in this position here, if a person's like this for most of their work day and they drive to the gym and then they come in for a workout, they're set into their flexion. We need to make sure to prevent disc bulge, especially into the cervical vertebrae, that the person can extend correctly. So with Robbie, I want you to look back to the ceiling as far as you can go. Good, and then back down to the centre. Now I'd like to do this movement about 10 times. There should be no pain, of course, with any of these movements. Any pain means you should see a professional. So, a couple more of those, Robbie. What we're doing here now, as you can see, is Robbie's head's now falling behind the centre of gravity, behind the point here of the 7th cervical vertebrae. So, his mass is falling behind, which is mobilising the vertebrae backwards. Now, this should ease up the more you do. At this early stage, you should start to get to a point where you're quite comfortable with. Now, making this part of your regular mobility work, you can relax there now, Robbie. So making that part of your mobility work prior to training, you tend to become accustomed to what good movement is. In the early stage, you're still learning. But as you begin to do this, you know what your good movement's like. On a day where you're very stiff, you need to do more until you move well into that position that feels comfortable again. You might come in on a great day and your neck feels good, you might do 5 extensions. Could feel great, I'm happy to go with that. Mobility becomes something that is personal. If I feel very stiff, I may do more sets until I feel good. So, the first thing I do is extension of the neck. Now, it doesn't matter whether I'm deadlifting, squatting, benching, I'm always making sure I'm doing my extension. Then we like to check our rotation. So we look around to the right as far as we can, Robbie. Good. That feels okay? Good. So I might do a couple more to the right there. Each time it's like checking your blind spot when you're driving. Amazing how many powerlifters you know can't do that. So we're getting our rotation there. Then we'll check it to the left as well. And we're not looking to stretch, we're looking to feel the joints moving naturally, painlessly, and well. How's that feel there, Robbie? Alright, you should be ready for action. So we're looking to get our extension movement here. So, looking to bring the head back behind the 7th cervical vertebrae. Bring the mass behind the cervical line, which you haven't been doing all day. Good, a few more of those. Great. Excellent. Now we'll look at the rotation. So, good. Yep, beautifully rotating around that spine axis. With thoracic spine mobility, this is one of the most important areas to look at, because not only in its own we're looking at thoracic mobility, but thoracic mobility has a huge impact upon shoulder mobility. So if we want to look at shoulder mobility, we really should be doing thoracic mobility first. So today we're going to look at the fact that thoracic spines tend to sit in a kyphotic forward position too much of the day, and what I want to do is make sure that our spines know how to extend and how to rotate both left and right. Most people being left or right hand dominant, whichever one, you'll tend to have a dominance to the way which you rotate. Now, under a lot of weight, we want to make sure that our mobility is as good as it can be on both sides. So now we shall go to our thoracic mobility section. Now, one of the most important areas to get mobile is the thoracic spine. Now, whether it's for shoulder mobility or whether it's simply to offset bad posture during the day and set you up for your lifting, we need to do thoracic mobility. Thoracic mobility I find is always best to do on a bench press. So what I like to do is set up a bar that's just around about the border of the lower scapula or shoulder blade area. So it's got to be a little bit low so that we can bend backwards over it. Once again, these things are all to offset the 20th and 21st century postures of being stuck in the flexion most of your day. Whether it's sitting and driving, sitting and eating, just all the flexion postures we tend to get stuck into all the time. We're looking to get some extension and rotation into the thoracic spine. This will then, of course, free up the shoulder for when we're into shoulder mobility. You can't really just do shoulder mobility without making sure that your thoracic spine's moving well. Alright, Dr. Robbie, put your hands across the front of your shoulders like this. Now here, we're going to use this bar a bit like a fulcrum lever. Robbie, get you to lean back over the bar and point your elbows up at the ceiling. Just bring yourself all the way back. Good, and then back to the centre line. Once again, mobility is not about pain, it's about reducing restrictions. So you're trying to get to an easy, feeling, good movement. The first couple tend to feel a bit rusty. And then by the time we get to that magic number, arbitrarily 10, we should find things move fair bit easier. Once again, if you're used to doing these, and you've been doing them for a while, you'll have a level to which your expectation will be. On the days that you find you take longer, respect that and take longer. That's looking good, Robbie. Putting those elbows to the ceiling. Superb. Great. Looks good. Yep, all the way back. Good. And relax.
Feel mobile.
Yeah. So now we're going to move on to the thoracic spine rotation. Remembering the thoracic spine, unlike the neck and lower back, also has ribs attached to it. So rotation is an important movement for us to address. Okay, Robbie, with thoracic rotation, I get you to sit up one ton tall there. I get you to turn around to your left and put your left hand on the top of the bench bar. Good, now put your right hand on top of the bar. Good, looking around to this left side. Good, and back to the centre again. Now we can go from there, now to your right side. Put your right hand on the bar, and then the left. And you'll always find one side's a bit more mobile than the other, but this one's really opened up quite nicely. Yeah. Good. Back to the left again. Good. Working it through. Good. So we're going to look at the rotation around to the left. So put the left hand on the bar, put the right hand on the bar, looking around, getting good rotation through the thoracic spine there. Great. Now we're going to go around to the right. Good. Great thoracic rotation. Really good. So once again, we usually aim at that arbitrary number. We'll call it 10. But as we say, once you get good at doing these, you'll know whether you've loosened up well enough in less reps or whether you need more. I usually recommend people do this during their day anyway, before training, when they sit in the chairs, somewhat doing sedentary work. It's a great way to make sure that you're staying mobile. If you're lucky enough, you have a bench press at work. The next movement I'd like to do to open up shoulders. After we've done our thoracic spine extension and we've done our thoracic spine rotation, we're going to then look at shoulder mobility. Now it's time for shoulder mobility. Shoulder mobility, of course, the shoulder is an inherently very mobile joint, opposed to hips. Hips are inherently stable joints. So with the shoulder, we want to make sure that we're getting as much mobility within the movements we're going to be trying to achieve. So when I look at shoulder mobility in regards to, say, powerlifting, I'm looking at shoulder mobility in regard to being able to squat, to be able to deadlift, and be able to bench press. I'm not so much looking at the ability overhead at this point. I'm looking much more at just being able to safely be able to put your shoulder through the ranges of motions that it should be able to achieve to be able to lift maximum weight safely. Now this is a lovely movement which uses muscles to help get the mobility going. So Robbie, take a seat here. And yep. Actually, I'm going to get you to turn and face that way because we'll get a better look at how we're going to go. Hold that stick up overhead for me. Okay. Now from this position here, you get your hands a little bit closer together, Robbie. Great. Now, from this position here, you're going to get Robbie just to actively pull the stick back behind the neck. As far back this way. Yeah, pulling it back there, as far back as you can go. That's it. Good. Stand up from there into overhead squat. Sit back down. Good. Now, pull back again further. Good. Now stand up again. We're going to do this 5 times. Sit back down. Pull the stick back further. Stand up again. Good. Sit down again. Pull the stick back further. Further it goes. Great. You're opening up really well. Good. And sit back down again. Pull that stick back further again. Stand up again. Good. From there, sit back down, and then put the bar behind the neck again now. Now, we'll just do a couple of squats from there. Good. Just 3 reps will do. This is a great move for opening up the chest and thoracic area. Good. Now, back overhead for 5 more reps again. So now you can see you started from a further back position. Pull back again. Good. Sit back down. Pull back as far as you can go. That's it. Great. Excellent. We've got 3 more to go. Stay from there and back further. Yeah, great. Opening up super well. Good. There again. Pull back. Great. Up again. Good. 1 more of those. Get the best position. Pull back. Open up. That's good. Great. Back down behind the neck again. And just do 3 more reps of squatting. You'll feel the bar sitting a bit more comfortable now. And great, you're relaxed now. So I tend to do a couple of sets of those until the shoulders really have opened up the chest. Right, let's open. Beautiful. So, apart from most of the very, very joint-focused movements we're going to do here, I also like to do some mobility that actually engages the lats. Lats are one of the most important muscles when you bench press, when you squat, and when you deadlift. Not everyone knows what they are, but the smart people know what they are. Alright, so what I'm going to do with Robbie now is I'm going to get Robbie to do basically a lat isolation movement. Because when he's going to be holding his squat, when he's going to be locking out his deadlift, when he's going to be making his arms and his bench, he's going to engage his lats anyway. So lats as being part of the shoulder complex, we're going to use them in our mobility work before we start. So Robbie, get you to put your elbow in the loop there. Alright. Now, the idea is Robbie's going to drive this elbow down towards his pelvis here. So the band is just gathered here, and you just drive that down to the pelvis. So that's it. Good. Now, do a few reps there, Robbie. You can sort of feel how the lat comes into there.
Yeah, straight away.
What we want to do is I want you to lean slightly into it as you bring the elbow down here, laterally flex into it, really bring the lat into it. So a little bit of lateral flexion coming in. Feel that? Good, because when you're going to get under the squat bar, you're going to drive your elbows down. You're going to make this really tight in there. Feel that?
Yeah, definitely.
Right. It's a great mobility movement to encourage the lats to be part of the complex here. This really decreases shoulder impingement quite wonderfully when you engage the lats. The lats inserting into the bicipital groove of the humerus. Right, Dr. Robbie, now you can do the other side. So this is very similar to almost like an isolation movement, like a concentration curl for a bicep. No, this is what I call the lock lat band, this one. I invented it, I never saw anyone else do it. I'll name it. Great, superb. There are some variations of this, but this is the one I always like people to work out, start with. Bring those lats in. Great, okay, great. Alright, what's that other one?
Yeah, that's great.
Just hit the lats.
So you don't need heaps of resistance either.
No, it's all about getting in touch with your lats. Okay, leading on from our lat band, once Robbie's felt what it's like to find his lats, because most people have never met their lats before, now you're going to know what you're feeling. So Robbie, put your hands by your side now.
Yep.
What I want you to do in this position, I just want you to reach to the floor with your middle finger, drive down as far as you can. Now in this position, if Robbie's trying to reach really hard down towards the floor, I shouldn't be able to move his elbows out, because he's locked in here. Now that, Robbie, feeling your lats down here?
Yeah, it's on.
Great, relax. Now what I'm going to get Robbie to do there is connect with his lats so that when he's benching, squatting and deadlifting, he'll know what he's feeling here. So I like to make people do this as part of their mobility warm-up, but it also brings the shoulders away from the ears. So another one, reach down towards the floor, feel those lats in here. If the lats are on, the traps are much softer. Good work. Okay, cool. Now Dr. Robbie's got a couple of favourite movements he also likes to move with as mobility. Robbie likes to look at some of the distraction movements, using a band for distraction. So here's a shoulder distraction movement, where the band is taking some weight out of the shoulder, and as Robbie relaxes, lets his shoulder open up, he lets the band pull the humerus. What do you feel with that one, Dr. Robbie?
All through the lats and posterior shoulder.
A nice lat stretch, good posterior shoulder movement. But once again, this isn't a stretch as much as it is just a bit of mobility in the joint Robbie's looking for. Looks great. Especially those who have had a little bit of posterior impingement, very nice movement to open up with. So it's for the mobility, we're not looking for nasty stretches. Good. Well, that's awesome. Now, we're going to be looking at lumbar spine mobility. Lumbar spine mobility for me is relatively simple. Lumbar spines, people sit in kyphosis most of the day. They sit in a position where they're slumped most of the day. As a result, their centre of gravity is too far forward, causing usually disc problems in about 80% of all adult population. So what we're going to be doing today, we're going to be looking at making sure that before you train, that you've addressed the mobility of the lumbar spine. We need to make sure that we can look at extension. All these movements are very simple, they're straightforward, they're natural movements. We're just looking to make sure that before we get under a weight, that we're in such a position that we're ready to load up safely. Next in our series is the mobility of the lumbar spine. Now, the lumbar spine. Each of the big vertebrae separated by a disc bone, all the way through. This is where the abdominals are, this is where the lower back skin is. Now, one of the things about lumbar spines is that the joints in the lumbar spine are relatively vertical. Now, that's why it is erroneous to bother doing rotational stretches for the lumbar spine. The lumbar spine doesn't have rotation as a major component. The bones will run into the other bones. They're not made for rotation. Rotation happens in your thoracic spine and in your neck. In lumbar spine, we're looking at flexion forward and extension backwards. Right, the most common problem that we find in lower back injury is disc injuries. Right, now disc injuries occur, once again, through the upper body, centre of gravity, falling forward into a flexed position on the spine. Now, similar to a kid's party balloon, if you put pressure down the front, you'll find things bulge towards the back. So in a disc, if a person's been sitting down for too long, driven to the gym, and maybe bent over to pick something up, all that happens is it takes a little bit more pressure, and we get our disc bulge in there. Now, the disc bulge has only occurred because flexions occurred, bending forward. The way we reduce a disc bulge often is by extension. When you extend over this thing here, you can't disc bulge posteriorly. As has well been noted, disc bulges occur and herniations occur only through flexion. Very, very, very rarely, possibly through compression. Disc bulge, flex. Going for a max, single, squat, let's go. As with all exercises, there are always exceptions to rules and everything should be checked by the appropriate health professional. This particular movement here we call lumbar extension. Now, because once again we tend to sit too much of our time in flexion, we need to make sure that our discs are protected by looking at extension. So, Robbie, put your hands on your hips here, and you bend backwards. Good. Shoulders go back, hips go forward, and back to the middle again. Just keep doing a few of those. Alright, once again, in a person who's been sitting for a fairly long period of time, perhaps driven to the gym, getting ready for training, you'll find that this movement increases the more repetitions you go until there's a point where it becomes quite comfortable. This should, of course, not be painful. This should be painless, just improving your mobility. Once again, at this point, Robbie's centre of gravity now falling behind his lumbar spine. This is with the disc. It's making sure that the posterior elements of the disc are being relieved of the pressure from an internal disruption. So how's that feeling, Robbie? Now, I've never seen anybody injure themselves once they have performed this movement prior to squatting or deadlifting. The people I find who have injured themselves are people who have never done this prior to doing their sessions. Sometimes I'll even do a set or two, 1 or 2 reps in between each set of deadlifts and squats to ensure that my mobility stays good in my lumbar spine. Now we will come to the hip complex. Now the hip complex, inherently a stable joint. So hips, as opposed to shoulders, tend to be more stable than they are mobile. So the demands of hip are more in the heavy weight bearing. So with hip mobility, what we're looking to do is optimise the range of movement that we have available in our hips to be able to perform our safe lifts. So within our hip mobility work now, we're going to be looking at some distraction movements and some opening up of the hip joint movements with kettlebells as well as bands. Well, one of the most important things we look on our list now is hip mobility. Now, an important thing here is hips vary quite significantly between human beings. So, you might see some wonderfully flexible, mobile individual doing the splits and think, I want to be able to do that. There's no guarantee that you will ever be able to do that. Your hip structure should normally be assessed by a fitness professional who understands how to find what hip socket ranges you have available to you. There are certain people in life who should never deadlift from the floor. It's like someone who's not allowed bright wanting to be a grand champion in chess. Sometimes some things just aren't going to happen. So, when it comes to deadlifting, it's always good, and squatting, to know what your hip structure's like. Now, to make the most of your hip mobility anyway, we like to make sure that before we train, that we've got painless, best range that we can achieve in our hips for this moment in time. Often I find we'll have two things. I find a person's functional range and their optimal range. Their optimal range might be the range that their body can anatomically achieve, but they can't quite achieve it at this moment because their muscles aren't balanced yet or strong enough to hold that optimal position. So then in training, what we're working in, we work in the position where it's functional. They're not in pain, they're working well from a certain position, but it's still going to be worked on for quite a while before they ever get to their optimal. So at this point, we're going to talk about more functional movement in the hip, just to open up before we train. So, Dr. Robbie, let's begin. The first movement I like people to do, anytime they have the opportunity to, is to start to open their hips up a little bit, is just to put the legs wider and with the hands, just open the hips up, just to give it a bit of resistance, pull it out, and hold it there for a couple of seconds, then bring it back in again. So relax it. This should be just a nice easy movement where you're just feeling as if you're opening up a bit through your hips. Now, you can see Robbie's at a certain point where it's sort of hitting a bit of stiffness there. That's okay, we're not trying to break through and make it a position you can't achieve. We're simply making sure that before we're squatting and before we're deadlifting, that we've got a nice open position through our hips and we're feeling as if it's a little bit easier to move. That's what mobility is about, it's about painless movement. How's that feeling there, Robbie?
It's different.
Opening up. Good. Now, there's no problem with, or no problem if someone wants to do this 2 or 3 times a day. You can sit down, a couple of repetitions here, most of us sit in our work occasionally. It's a great opportunity to stay. Find where your comfort zone is, find where you can open your hips up a bit too. So with this one, we're just going to do a bit of a goblet squat. The idea is simply using a kettlebell as our counterbalance weight to allow us to stay upright. And Robbie, squat down into that position, bring your elbows aside your knees, stay down there. Good, move a little bit, up again. Yep. And down. Good, working this well. Yep, a few reps in there, just to start to feel the hips getting deeper. Good, up again. Yeah, get a nice bit of depth in there. The foot position is really important in these. It should be comfortable, just like Robbie's got. It should be a nice line coming out of the thigh, to the knee, down the tibia, out the foot. Nice open movement. Yep, and there you go. Once again, using that arbitrary 5 to 10 reps, it all starts to feel nice and easy. There we go, nice goblet squat. Great, that's good. Great, neutral squat. Wonderful. Very nice. Loosening up?
Yeah, definitely.
Right. Alright, and done. Okay, Dr. Robbie, we're going to do, this time, one of our favourite movements, the bicep curl in the bottom of the goblet squat. So, down you go, Robbie, into that position where the elbows are inside the knees. Now from there, just curl all the way up in front of you, that's it, and up again. And allow your body to sink into the movement as you feel it's doing. There's the moving centre of mass of this weight here, which allows the body to find a little bit more motion, a little bit more hip opening. Really look at Robbie's getting superb depth out of this right now. Looking really good. So there you go, bicep curls will make your hips better. So away we go with the bicep kettlebell curl in the bottom of the movement. Great. Taking your time, you can see the body rocking slightly back and forwards. It's allowing the hips to just open up a little bit of mobility, a little bit of, let's say maybe the fluid in the joint being allowed to move a little differently. Great, that's good, Dr. Robbie. Pumping up awesomely. So, one of the most important mobility movements I look at now is actually using the glutes now to actively work on the head of the femur. Now, a lot of people have acetabular impingement, can improve dramatically by actually working with this movement here. So, what I like to do is I like to do a single leg bridge. So Robbie, I'll actually put your right foot up on top of your left knee there. Good. Plan here, we're trying to make the glute form an extension. It's pulling on the femur, so it's bringing it backwards. So you lift the hips up in there, Dr. Robbie. Good. And down. Great pace, keep working on this. Now, Robbie, always trying to work on that, down, trying to make him bring his left pelvis, his right pelvis up a little bit as you go. Trying to keep it level across here. It's hard work on the glute. Feel that? Right. So this is pulling the femur back in the acetabulum. It's a really good movement before we squat and deadlift once again to get the glutes actually activated before we start. So the glutes are being put on notice. Look how we use today. Up again. Great. Looking good. I often do this and retest when I'm doing the impingement test. About 10 reps, maybe 15 reps when I'm doing it as a test. But as a mobility movement, I'll look about 5 to 10 repetitions, maybe a couple of sets if you really find it's firing you up. Excellent, Robbie. Both sides done naturally. Right, Robbie, we're going to be doing the single leg bridge. Once again, what we're doing, we're looking here to activate the glutes, to pull the femur back in the acetabulum. Up we go. We're going to do a single leg bridge. Now this side's a bit tough for you. Up you go again. Good. We're trying to make the pelvis stay even. Robbie's going to pick up this left side of the pelvis up there. Good. Making that work better. That's great. Now, our patients who have been scheduled in for hip surgery for impingement syndromes that have never had surgery, once I found that I could clear their impingement with glute action. So, this is one of the first tests I often do if I'm looking at having found an impingement. I'll see if I can activate the glute to clear the impingement. As a result, it's a great mobility movement before squatting and deadlifting. Good single leg bridge, keeping the pelvis as level as you can. It's hard work.
Yeah, especially on the right.
There you go. So often with some of the more irritable hips, I've always found this to be a wonderful movement that sometimes opens hips up quite well, and Robbie really likes this one. It's basically a hip distraction movement where the capsule is being opened up. So Robbie's attached a band to the rack and a band to his foot, and let's get you to demonstrate your hip distraction. So from here, Robbie's finding a little bit of tension, and then he sets up and allows the band to open the hip joint up. So a nice distraction of the joint. This, anybody's had a bit of impingement, this can be a really nice, easing movement. Irritated hips really love with the distraction. So often we'll do a few reps until the body really seems to feel like it's opened up nicely. With some of the irritated hips, I really like to do this about twice a day. So it's a matter of passively letting the band take the tension out of the hip and opening it up. Just allow it to take it there, Robbie. That's great. Let it just pull yourselves out. Sometimes we use a rhythmic contraction to it, a bit of pressure on, a bit of pressure off. It becomes a personal decision with this one, how you tend to feel that helps your hip the best. But it can be a very nice movement. Looking good?
Yeah, alright, you're on.
Alright. A fantastic distraction maneuver that Robbie's going to use here is a band traction distraction movement, where the band's on the inside of the thigh, and Robbie's going to come on out using the band to traction the hip out openly. Opening up the hip. So the band's taking some nice pressure at the upper part of the femur, the knee down here is fixed on the floor, and the band is up near the groin, pulling open the hip. So it's a really nice movement that you can pulse into or you can hold. Once again, opening the hip up. These are great movements for really easing up irritable hips. Once again, these are the things that you find they're part of your toolkit. They're part of things you might like to experiment with. Some people will like them more than others. All the exercises and things we go through today, they're things that you can choose to work with and test for the things that you really like for yourself. Robbie really likes this. It's a great technique. I've used this for lots of older hips as well. I think it's a real winner.